This is the second part of the video for neurofibromatosis, and we will discuss here type 2 neurofibromatosis. Let's see the question. 23-year-old man present to the emergency department for worsening hearing loss and headaches. Medical history is otherwise non-contributory. Family history is notable for mother having meningioma and progressive hearing loss. Physical examination is notable for papilledema and bilateral sensory neural hearing loss. An MRI of the brain, which is given here with and without contrast, demonstrates bilateral enhancing lesions by the internal acoustic meatus and an extra-axial mass arising from the dura, which can be seen here. So let's talk about neurofibromatosis type 2. It is a genetic disorder, as we saw in type 1. It is characterized by bilateral vestibular schwannomas, meningiomas, ependymomas, and juvenile cataracts. So these are the things that you will be seeing in NF2. If we talk about the risk factor, family history is the biggest risk factor. Let's talk about the pathophysiology. Neurofibromatosis type 2 gene encodes Merlin, which is also known as schwannomins, which is a tumor suppressor, again similar to the type 1 which we saw on the previous video. So there is loss of Merlin, which leads to abnormal cellular growth and proliferation. If we talk about genetics, it is autosomal dominant mutation in neurofibromatosis type 2 gene on chromosome 22. If we talk about the symptoms, the hearing loss is main. There is sensory neural hearing loss, tinnitus, vertigo, an issue with the balance. And if we talk about the physical examination, there is sensory neural hearing loss. Talking about the imaging, MRI of the brain and spine with and without gadolinium, that is a contrast. If the indication is the imaging study of choice is MRI, and finding would be bilateral vestibular schwannoma, meningioma, or spinal ependymoma. If we talk about the differential, it is of course neurofibromatosis type 1. And what are the different differentiating factors? There are many cafeolate spaces which are not seen in NF2. The cafeolate macules, the freckling in the axillary and the inguinal region, which were these two are the very most important thing in NF1. There is iris hematomas or hematomas, also known as Lisch nodules, and neurofibromas. These all are seen in NF1. If we talk about the treatment of NF2, it is mostly surgical, and that is resection. It is preferred treatment option for resection of vestibular schwannomas. Radiation therapy is an alternative. However, there is a risk of malignant transformation or the development of new primary tumor. So the resection, the surgical resection, is the most important part here. If we talk about the complication, there is hearing loss, seizures and brainstem compressions, cataracts, and peripheral neuropathy. Thank you.